If we look at 4.7, 4.9% unemployment across North Carolina and think, it looks pretty good, that doesn't tell us the whole story, does it?
It does not, and anyone who's been in North Carolina long enough knows that we do have a lot of variation in all the economic numbers, but especially unemployment. And this has been examined many times in other states, but I took a fresh look at it for North Carolina, and I found several things that people probably would shake their head and say, yeah, I understand that. A couple things they did not. The things that people would shake their head and say, yeah, that makes sense is, number one, is counties that have a higher proportion of their workers with college degrees have lower unemployment rates. And I think that's because the economy is changing, businesses are changing, economic sectors are changing, and having a college degree helps you get a wider variety of jobs. Secondly, I found that counties that have grown faster, just in terms of raw population, have had lower unemployment rates. So right there, you get a good picture of why, for example, the Charlotte metro area and the Raleigh metro or Triangle metro have lower unemployment rates than, say, the Northeast counties or the South Central counties. Now, the couple factors that I looked at, and this is based on other research that perhaps is surprising to people, is looking at the characteristics of the workforce, particularly in terms of characteristics that might cause employers to say, I'd rather not go to that county because there may be some issues. And the two things I looked at were obesity rates and a measure that tried to capture the prevalence of drug use by individuals in the county. And I found for both of those, and this is in a statistically significant sense, that they did impact county unemployment rates. That is to say, the higher the obesity rate in a county and the higher the rate of drug use, the higher the unemployment rate. And I think what the explanation for that would simply be is that certainly with drug use, that makes perhaps individuals working less reliable. I mean, some issues there, and I think there's some evidence that obesity rates maybe are related to higher healthcare costs, and of course many businesses bear those costs. So that tells me that policies that try to reduce obesity and drug use are not just social policies, but they're economic policies.